Hi there everybody, it's Dr. Steve with Kinesi, and this is your Start Your Healing Now. Here we're into part 3 of low back pain disc issues. So in part 1 we talked a little bit about some of the sitting posture, how to make adjustments there. We started to get into some hip flexor stretching, which gets gummed up, and it attaches to the whole lumbar spine, and so that can be a big part of causing some pain, some tightness, some discomfort with disc issues being what's going on. And then in part 2, we went into the upper back, the trunk, getting that moving in a variety of directions. And in part 3, what we're going to do is some squats, but some supported squats. So as surprising as it seems, disc issues actually like squats. They like body weight squats, and lots of them, because that turns on all of the hips and the glute muscles, which are really helpful for everything. Heavy weighted squats, I wouldn't recommend when you're having a disc issue. There's a time and a place for that, but when your disc is unhappy, putting a bunch of extra weight on your shoulders, that's not quite the time. So what we're going to do is a bunch of squats, but body weight squats. But I want to also have you do a supported squat. So a supported squat is where you're hanging on to something. I conveniently have this post here, but using a railing, sometimes even like the back of a chair or something good and solid. But railings work great, posts work great, door jambs, the edge of a desk or a dresser or whatever it is. But what we're going to do is we're going to vary our foot position. So, and I'm going to take you through this, but first we're going to start with the feet hip width apart. And the idea is that you're hanging on with your hands and the hips are going way back. So we don't want to have it tucking underneath us. That's going to put more pressure on the knee and on the knees, and the butt is dropping underneath us. That's not quite what we want for this. We want the butt going way back into that squat as if there's something that you're going to be sitting onto, but the hands are hanging on, and they are like hooks that are giving the upper body some support. So as the hips keep going back and the hands are hanging on, you're creating a decompression in the spine, a traction motion, which discs and spines like. So we do some squats here with the hands hanging on, the butt going way back. And then we're going to start to change the foot position. So let's put the left foot forward just a little bit. Now, when we change the start position for where the feet and the body parts are, we change the joint angles, we change the emphasis on the muscle groups. So here we do the same motion with the one foot slightly forward, and it's got a little different feel to it. And then after doing some with the left foot forward, we switch it up. The right foot forward, going through, doing those same kinds of squats. And then after we have the right foot forward, now we're going to go extra wide. So feet are just a little wider than the shoulders. And then we go through the squats. I do want to have you stand tall in between each one. So it's not just a little squat where you're pulsing at the bottom, but we want to go through that complete range of motion to stand tall at the top. After wide, then we're going to go to narrow. So this is just having the feet kind of inside the hips, doing our same kinds of squats here. Good. Butt still going back. Then we're going to go back to hip width apart, but now what we're going to do is we're going to angle toes in. And so this feels a little funny for many people. We're angling the hips into internal rotation. We're lengthening a bunch of the muscles on the back side of the hip, so this one often feels really good. And then we're going to finish it up where now we're going to turn the toes out a little bit and go through the squats. So you can listen to your body and go by feel. Somewhere, say 3 to 5 to 10 repetitions for each of those. We did 7 different positions here. We went hip width apart, 1 foot forward, the other foot forward. We went wide, we went narrow, we went hip width apart again, toes in, and then toes out. So each one of those little variations will tweak the start position, change the joint angles, change the emphasis on the muscle groups. Lots of repetitions going up and down in a pain-free range of motion is going to make your back happier, discs like it, it pumps fluids around, it turns on muscles, it stretches things, all in a good direction of you feeling better and functioning better. So there we have part 1, part 2, and part 3 of Start Your Healing Now for low back pain and disc issues. If you or anybody that you like has a back issue that they're struggling with, send them in, let us help, let's figure out what's going on with them and come up with a specific plan for their body's needs. So be sure to be on the lookout for, as we continue this series, other body parts that we're going to work on and ways to get you started when you're not sure what else to do or where to begin. So until then, bye-bye everybody.